Hi, this is Josh, Dream Body Clinic, and today we're going to talk about the stem cell facial treatment. So we'll call this the ultimate guide to the stem cell facial treatment, and we're just going to get right into it. I'm a big fan of the facial treatment. I do it at least once a year, sometimes twice a year, to kind of keep my skin young, to keep looking fresh, and that's a big part of anti-aging, is your appearance. So with our treatment, we do a combination of different things. It's not just, hey, I'll put some stem cells in, hope it works. No, we've got a whole protocol for this, so we'll just get right into it. So we always start by applying it's kind of a cream gel to the face. This is a combination of lidocaine at 28% and 7% tetracaine. What these do is numb the face up. Because nobody likes needles, because we are going to put needles in the face with this treatment, tiny insulin needle injections, but it's not fun. So we want to numb the face up first. That takes about 30 minutes before it really kicks in, and then the doctors go with the procedure. So before we get to poking any needles, anything, we start with a device called the Thermage. The Thermage is a RadioFrequency device that the doctor is going to put on the face, and you'll see some video of it here of me getting the treatment. And what that does is it causes the radio frequency gets below the skin and it kind of heats up. It's almost like how you microwave your food. It's heating up below the surface, and with that it's going to cause some damage to the collagen, but it's also going to help the collagen to constrict and tighten up, which tightens up the structure of the face and the skin. This can help to reduce wrinkles. This can help, like, you're starting to get kind of like, turkey neck, things like that, to tighten up. So it's really great for that, but we found that's not quite enough. You can only do a Thermage session about every 6 months, because otherwise you'd cause too much damage. Well, now we've caused some damage, we want to use the thing that's going to help repair that damage. So then what we do is the doctor comes in and starts injecting with the insulin needle mesenchymal stem cells. We use 20 million mesenchymal stem cells, and these are able to get in below the skin, into the collagen, into where the elastin is, into where the fat in the face is, and start guiding the cellular regeneration. So now that we've damaged the collagen a bit, the stem cells are going to be attracted to that. They're attracted to inflammation, and we just caused a lot of inflammation throughout the face. So they will be attracted to that, and they will then help guide the rebuilding of that collagen. Get it nice and tight and perfect, which is going to help tighten the face. It's more collagen means that you're going to have more fuller face and hopefully reduce the wrinkle lines. So that's a big part of that. It also helps with elastin, which is what basically allows your skin, ligaments, tendons to stretch and then go back to the original size and shape. Same with the skin tissue. And we want that because as you lose elastin, that's when you start getting the wrinkles. That's it's stretching too far, and now you got a mark, a line, and that line stays, and it only gets deeper over time. So the stem cells do a great job of actually reducing those lines and helping everything tighten up. Now, look, this isn't like Botox. This isn't instant. It isn't boom, face is all zero wrinkles, nothing. What this does is slowly over time, it's going to tighten these things up. This is a sort of treatment that you're going to see peak results usually 3 to 6 months post-treatment. And the cells, they're going to stay in there for anywhere for 8 months to a year. So they're in there working, it just gets better and better. Now we do combine the mesenchymal stem cells with PRP. That is platelet-rich plasma. And PRP is loaded with growth factors. In fact, there's, I think, 6 different growth factors, 6 different cytokines, which help with, regenerating tissue, with help with new vascularization, things like VEGF. And the stem cells do this too. They help with creating new micro blood vessels throughout the skin. The more blood flow you have, the better things heal, the better cellular health that you have. So it's this combination of different things that are doing that. Now the stem cells, they have effects on a few different things. They're also going to help with inflammation. We just caused some inflammation, like I said, so by reducing that inflammation or any others, they're going to seek out the root cause of that inflammation and guide the cellular repair. They're going to help with new blood vessel growth. There are a lot of blood vessels in the face, a lot of capillaries and micro blood vessels. They help with new vascularization, repairing damage, and just getting the blood flowing so you can have that nice, full face that's, looking tight and, rejuvenated and young, which is the goal at the end of the day. So we get all of that, and then with the tissue regeneration, they have a huge interaction with the fibroblasts. And fibroblasts, they can help those to develop in the area, which will then, convert into collagen, new collagen production, new fat production in that area, and new elastin production. All of these things help keep the face looking full and young. So again, this is an amazing treatment for rejuvenation, if anti-aging and aesthetics, and if you're vain like I am, this is the treatment for that. It helps keep you looking young, and think of it as a way to stop or even slow down the aging process. If you've already got very deep lines, this isn't going to get rid of the super deep lines. It will help reduce them. It's going to, make your skin tone look better, because after we do the injections, deeper in, we do a superficial injections with a dermapen. So we're going to squirt some of the PRP and stem cells on the face. We use a dermapen that has 32 microneedles, and it goes all over the face, and it feels like almost a nice massage. Doesn't hurt at all, and that gets the cells into the skin layer, which helps the skin to rejuvenate, look younger, kind of get that glow, that shine. I mean, people really notice with this. And for certain patients, we do throw in some different things like hyaluronic acid or some vitamin C. I mean, the doctors are real specialists at this. Like, both of our doctors have done extensive extra, classes and courses on facial treatments. So they adopt the treatment to each person has different needs, and they're going to specialize that and make sure they add some of those things in. So it's a multi-layer approach. And then when that's all done, we also give all of our patients a cream. A cream and a spray. Let me see, I've got the spray here. So this spray is awesome. They call it the facial hydration tonic. I'm pretty well addicted to this one. You spray it in, wipe it on, and your skin feels awesome all day. Its main ingredient is glycerin, and if you do some research on glycerin, incredible for hydration and keeping, liquid for cells, and hydration in the skin and the face is the best thing you can do. In fact, they're finding more and more things where glycerin is like oral supplement for athletic performance is incredible, because it keeps the water retention so that you can go longer. So putting it topically in the face helps a lot. There's also other things in here like vitamin C and I don't remember the whole list. It's on the website. And then we give a cream that patients are able to use that is actually made from the culturing solution from the stem cells. So when we do the stem cell process, we isolate the cells from an umbilical cord. We then isolate just the pure mesenchymal stem cells, and then we add a culturing medium, which is a liquid solution of all the nutrients the stem cells need, and we put in that in an incubator, which is like a specialized oven to keep an exact temperature, and this allows the cells to replicate. This is called meiosis. All cells replicate. They technically will call these daughter cells. Well, it's not actually technical, but a lot of people are using the term daughter cells. It's ridiculous. That's just, meiosis. Cells replicate, perfect copies of them, and we expand to the third round and get hundreds of millions to billions of stem cells for each culture for that day's patients. So they're coming out fresh. Well, the culturing medium that we use, a lot of different growth factors and cytokines and chemokines and nutrients and all these things are left in that. So what we do is we then filter out the MSCs, because those are isolated and put in a sodium lactate solution for treatment. Well, the culturing medium, like Dr. Riordan, if you read his book, Stem Cell Therapies, A Rising Tide, which is a great book, he talks about this. They call this magic juice. And this magic juice is loaded with so many good growth factors and different nutrients that they find if you can put it on the face right away, it really helps with just facial rejuvenation and anti-aging. So what our lab has done is created a cream, or a gel cream, that is more stable and can last, and you can apply this on your face. So we hit it from every angle. We look at the hydration, we look at the inflammation, we look at treating the damage, the skin rejuvenation, everything. So our treatment in total consists of PRP, which is where we take your blood and spin it, take out the platelet-rich plasma, mix that with 20 million mesenchymal stem cells, and before that we apply the Thermage, then we apply this combination of PRP and stem cells, and we normally just do the face. For some people, they want to get their neck. There is enough that we can extend that to the neck if you want that, and that treatment's done. It's super simple. We do it all here in-house. And it's helping a lot of people just stay looking young, and that's the real goal with it. Now again, it can be used if you're using fillers or Botox, anything like that. In fact, we've had people get off of Botox and be able to, get their skin just looking healthy without it. Because the problem with Botox is that it freezes the muscles, so they start to atrophy, and that actually, if you stop doing Botox, you're going to look much older than you did if you didn't, or you did before if you'd never done it. So most people have to keep doing Botox. This is a way to wean off the Botox, build back the muscle, build back the collagen, build back the elastin, and be looking young again. And the nice part is the Botox usually freezes everything so the wrinkles are gone, and now when you do the stem cell facial, well, those wrinkles, you're starting from that point. You're not starting from the point you were before where they were deeper. So we're not against Botox. We think it's a good idea to do you have to do it at least 1 month before treatment. And if you've done it, no big deal, but this treatment will help tighten everything up and hopefully either get you off Botox or need much less. Same with fillers, those have no negative interaction. But a lot of people are finding if they've done the fillers, they usually don't have to do them as soon after or even at all because it filled things in, we built back the collagen in the area, and those lines are gone. So that's what this treatment does, a little bit different than most things out there, and it's real cellular regeneration. So that's our goal with it, helping people look younger, feel better. And it's a really good one to combine with our stem cell IV treatment. That's our internal IV treatment, which that helps the skin a lot too from the internal sense. So look at that. It's all on the website at www.dreambody.clinic. You can call us toll free to learn more and get a free consultation anytime at 833-445-9089. I'm Josh. Happy to help.